Professor, Department of Onco Anesthesia and Palliative Medicine in the Dr. V Ambedkar IRCH Institute of Rotary Cancer Hospital and the National Cancer Institute, All India Institute of Medical Sciences, New Delhi. And Dr. Rakesh Garg to talk about has got so many accolades and everything in his credit. He is a professor of Onco Anesthesia and Pain and Palliative Medicine in the All India Institute of Medical Sciences, as I already told, and he has got the fellowship in palliative medicine from the Institute of Palliative Medicine, and he is MD anesthesiology. Busy schedule as per his profile. You might have seen Sir is really busy person, but still Sir has that heart and willingness to support all of us. And so he's a role model. He's a Florence Nightingale awardee, just like Jeena Pradeep ma'am. Jeena Pradeep ma'am got in 2016 also. He has got Suresh DP has got it in 2012. That is the Florence Nightingale, the highest award for the any nursing professional in India. That will done, sir.
Thank you so much, Guru. Thank you, Madam Jeena Pradeep, for spending time and giving the motivational talk to all the nursing college students and the staff. And thank you, Hamza, for always taking this initiative to create awareness station. And thank you, the whole principal, the teachers, and the students of Arogyam Nursing College. This patient suffered or had an advanced metabolic disease, and now he is suffering. And that is what palliative care comes into the picture, which was started by Dame Sister Saunders way back in 1967, and she laid down the path of starting the palliative care of the hospice movement across the world, starting from. And when we talk about oncology patients, at some point of journey, in spite of treatment, almost 2/3 of patients will be in advanced stage some point of time. And herein we have to provide them a symptom support. And this is what the standard definition comes by WHO, where we not only talk about the physical management, that is physical symptoms, but what more important, understanding of the palliative care is the other aspects, the other domains which include psychological, social and spiritual aspects. And these are equally important when we talk about suffering of the patients. Now, when we talk about palliative care, sometimes we think that it would be a huge infrastructure, it will require a in-hospital setup with many machines, medications, equipments, trained staff, and so on and so forth. But we need to understand that palliative care is basically care to cure and doesn't require a very high intense equipment-based management. It just requires no technology, but understanding the patient, the empathy is more important. There will be a aspect of life, but we are not changed to life. So this means that probably we are not saying that nothing can be done for these patients who are suffering from chronic disease, because require palliative care, supporting care for a long duration. Third group of patients, the lowest down, the green color graph, is more of a neurological patients, therapy patients, dementia patients. Now these patients suffer slowly because they will have a progressive neurological deficit, and once they will have a decline, then finally they will settle to that someday. And their functionality will be going gradually down day by day. So this is where we need to understand that the need of palliative care quite fluctuates in these patients. So when we say need of palliative care, it cannot be static. It cannot be a prescription based for long term that just remove it and can continue. We need to assess these patients because their need will vary. And if the need varies, we have to perform differently so that we can provide them comfort care. So this is what I have said till now, that patients, so that the symptoms decreases. Is getting treatment, and we have a built-in intent but he still have symptoms. He can have psychological depression, anxiety, he can have social impact, he can have physical symptoms like pain. Though he is curable, but he still have symptoms. So palliative care is an umbrella provision of services to all the patients who suffer from chronic disease. Yes, end of life is one of the component. So this is what we follow. So that's why we need to understand this phenomena well. And that's why the role of do not accept that resuscitation comes in these situations. So this means the palliative medicine is for all age groups. Even when we say the small child suffering from genetic disease, metabolic disease, where the survival is not good, we have to give them a supportive care, palliative care. Patients with any organ failure, they can be given. They can be given at any place, and it's not one speciality. It is across the speciality. A patient may be admitted with nephrologist. Patient may be under the respiratory physician. Patient may be with cardiologist. Patient may be oncologist. Patient may be gynecologist. Patient under medicine.
Gayatri from BSc Nursing first semester. So my question was, what kind of data shall we collect, and what kind of data should be maintained during the palliative care, and how much is it important?
You manage it, but then it may get metastasized to vertebral body or to the brain. He may or she may have seizures now or a paraparesis now. Now the requirement of the patient is altogether different, and again it needs to be documented for the new symptom origin, and we need to manage it. So this all needs to be documented clearly, and that's why the one point of contact always remains good, so that we can.
A beautiful smile on your face. And if you smile, that makes that person who is opposite you also happy. Okay. It should be an open body language. Don't keep put your hand. Don't be that open. Patients should feel they can talk to you. Process of communication is complex because when I talk to you, what is there in my mind, in my thoughts, and you will know. And the same thing, what is going in your thoughts now, I do. That's the complex. Even at home with your friends, everything is happens. Reactions. We know that we are upsetting the patient. If we tell them about their disease or their prognosis, we may upset them, and then they will start crying or lose their temper, and you don't know how to handle the reaction. Sometimes you should be ready to listen to understanding, don't go on daydreaming, be emotionally calm. And knowledge, there is no substitute for knowledge. That I told you before only. Okay, so in effective communication, listen. God has given you 2 big ears. To whom you are talking, it matters, whether it can be anyone. Our body language might matter.
For today's session, for constant support, guidance, and dedicated efforts in planning and executing this national webinar successfully. Thank you both of you, sir. I also thanks to our management for continued support to make this webinar successfully completed. A special words of appreciation goes to all principals, faculty members, all students who joined from different state, city, and college. Thank you so much for joining us today. Your involvement made this webinar truly successful. We hope the knowledge and insight gained today will contribute positively to your profession and academic growth. Thank you once again, all of you.